Hello, everyone. Thank you for joining us for Global Genes Live, a Rare Patient Advocacy Fund Summit. My name is Dakota Fisher-Vance, and as a member of the patient advocacy team at Horizon Therapeutics and a rare young adult always looking for extra financial tips, I'm super excited to be your moderator today at Patient Stories, How to Become a Proactive Financial Advocate for Young Adults. Before we get started, I do have a few housekeeping items. Everyone joining is muted to avoid any interruptions, but that doesn't mean that we don't want you to share your voice. We encourage everyone to submit questions by using the chat feature on 24, which you can find through the blue chat button at the bottom of your On24 screen in the meeting settings. And, we are talking young adults today, so I think it's only fair that we mention social media. Please do share your favorite moments and takeaways from today's sessions and really throughout the whole Summit by tagging Global Genes at Global Genes and by using the hashtag 2020GG Summit for a chance to be featured on Global Genes social media pages. And just take a second to sit back and enjoy and be an active listener. I think we all can be better financial advocates, and I think it's a pretty safe bet that our amazing panelists today have some pretty incredible insights for us. So enjoy listening, submit your questions. We'll try to get to as many as possible, and those that we don't, we'll follow up with you afterwards. And with that, it's my pleasure to introduce today's panelists. First, we have Hannah Olson, the founder and CEO of Chronically Capable, Sumaira Ahmad, the founder of the Sumaira Foundation, and then Sneha Dave, who's the founder and executive director of the Health Advocacy Summit. Welcome, everybody. So I thought we could start off if each of you could tell us a little bit about yourself, what kind of work you do to empower rare young adults to be more independent and to be strong advocates for their financial health. Sneha, do we want to start with you?
Yeah, definitely. First of all, I'm so excited to be here with my fellow young adult patients as well. This is really cool to be on a panel like this. So my name is Sneha, and I was diagnosed with ulcerative colitis when I was 6 years old, and I now live with a rare disease called chronic antibiotic refractory pouchitis, which I'm currently seeking treatment for at the moment. When I was in high school and in middle school, I went through a period of isolation for about 5 years due to the severity of my condition. And as I emerged from this isolation after having major surgeries, I realized that there were a lot of vocational, educational, institutional, economic challenges of growing up with a lifelong condition. And so I created the Health Advocacy Summit, which started out as a day-long summit in the state of Indiana in October 2017. And we discussed topics such as navigating employment, the transition from high school to college, college to the workplace. We talked a little bit about health insurance, health policy, and mental health. Since then, we expanded to about 6 different states, which we were supposed to be in 2020. And we have shifted quite a bit to having more programming, such as a Keep High-Risk Students Safe campaign, which we created to ensure that high-risk students during the pandemic have options and resources to navigate the school system themselves. And we also hosted a major international summit on Saturday, August 8th with over 300 young adult patient attendees from around the world. And we are led entirely by young adults with chronic and rare diseases. And I also wanted to acknowledge, too, I think especially when we're talking about financial resources, to think about, for not only the panelists, of course, but also the attendees, to sort of think about, the privilege that we all have in being here and coming together. And maybe also think about, ways that we can empower others to have resources and have educational opportunities as well.
Fantastic. And yes, hopefully this whole panel will be a very empowering experience. Hannah, how about you?
Yeah, so great intro, by the way. My name is Hannah. I'm so happy to be here today. I'm joined by my fellow panelists and to speak with all of you today. I also suffer from a chronic condition. Myself, it's not a rare disease, but I have chronic Lyme disease. I was diagnosed while in college at Boston University. And after I graduated, I landed what I thought was my first dream job out of school. I wanted to be, have a big career and move forward in the workplace, but I was struggling with long-term treatment, including being hooked up to an IV for about 8 hours a day. And after this experience, I was really defeated and I struggled with, is there a place for people like me? is there a place for people with illness or disability in the workplace? And for a while, I really thought that there wasn't. And then I decided from this experience that if I wasn't going to do anything about it, then no one else would. And so I started Chronically Capable back in 2018. We are a job board and recruiting platform for folks who are suffering from a chronic condition or a disability. We seek to empower folks to seek out careers and to become financially literate. It's something that I think has really helped me to move forward in my healing as I am now pursuing a career and am able to give back to my community. I'm excited to be here today and joined by such wonderful panelists. So I'll leave it at that, but excited to dive in deeper.
Fantastic. Thank you, Hannah. All right, Sumaira, how about you?
Well, hello, everyone. First of all, those are very difficult intros to follow up to. Pretty amazing panelists we have here today. Hannah, I also went to BU. I graduated in 2010, BU Terriers. So my name is Sumaira. I am the founder and executive director of the Sumaira Foundation for NMO. I started this 6 years ago, just 2 months after I got diagnosed with a rare autoimmune disease called neuromyelitis optica. It affects the central nervous system in the optic nerves and the spinal cord, leaving patients blind and or paralyzed. Unfortunately, right now there is no cure and they really don't know exactly why it happens. While we thought it was very, very rare when I got sick, we're finding out more and more now that it's not as rare as we think, as the misdiagnosis rate is 35%, which is incredibly high. The foundation that I started focuses on raising general awareness of the disease so that everyone sort of knows about it. And all of the money that we raise is given to research to find a cure. And we're very passionate about building a positive community of support for patients and their caregivers. And, you know, the underlying message in all of our core messaging is that you are so much more than your diagnosis, and we hope to empower our community in more ways than one. So I'm very happy to be here, and I hope that I can contribute to this wonderful and important conversation with some of my own personal experiences having navigated the financial woes of being a sick patient.
Great, thank you. We're so excited to have all of you. And I think, you know, for me, when I think of financial advocacy as a patient, one of the hardest parts is there's so many terms and what do they all mean? So I thought we could start out with really the first term, which is financial advocacy. What does it mean to each of you? Sumaira, do you want to kick us off?
Oh, of course, I get the hard question. You know, like you said, it means something different for everyone. And for me, what it meant when I was really in the thick of getting diagnosed is how do I sustain financially the life that I was living, now accompanied by all these new expenses that come with having a rare disease. So, you know, it was, of course, everything from insurance to something as simple as, you know, taking an Uber to my infusion appointments, and that sort of added up, and co-pays and the over-the-counter medications that you need. So I think, you know, being a financial advocate means managing all of the related expenses to being, you know, to having an illness, especially at a young age, and sort of navigating the different systems in which you have to do that.
I agree. All right, Hannah, what are your thoughts?
Yeah, so I'd love to echo a lot of what you just said, but I really learned what it meant to be a financial advocate as I made the shift from being a college student to entering my first career. I think I know that I was very fortunate to have parents that were able to support my health insurance and my medical expenses during my college years when I was in the thick of my diagnosis. But as I entered the workforce and I was suddenly on my own insurance plan and, you know, still really going through intensive treatment. Sorry, my puppy is running around behind me. Going through my treatment for Lyme, I was starting to get these massive hospital bills and medical bills, and being able to go through those and actually fight back against my insurance company was my real first experience of saying, you know, you have to be aware there's not an adult here to do it for you anymore. You are the adult now. And so I think it's really about being able to advocate for yourself, especially seeing tons of different doctors, all with different copays and as you mentioned as well, the Uber rides, all of this all adds up. And so making sure to really take into account all of the factors that go into managing an illness. And that was a really hard lesson to learn. And it's a very important one to learn. I now find myself really putting my health and those expenses first and foremost, because that's what I need to survive. And so it's been a long ongoing learning process, but I think it really means to just continue to read and to follow up on things, and don't just settle for the first bill that you see, or and to really just continue to advocate for yourself.
Yeah, I hear that, and I definitely hear a lot of navigating systems, a lot of, again, like we think of independence as young adults, like, oh, so exciting to, like, I don't know, get in the car and drive wherever we want, stay up as late as we want, but we don't think about that financial piece of, oh, insurance is on us now, and figuring all that out. All right, Sneha, how about you?
Yeah, I would echo what both Sumaira and Hannah and, of course, Dakota, you just said. When I think of financial advocacy, I also think of financial literacy. So, navigating these really complex systems take a certain level of literacy and education that not everyone has. So, both my parents immigrated from India, and they weren't necessarily aware of how to navigate these big macro, systems, whether that's insurance, co-pays, patient assistant programs. There's a lot to think about when we're thinking about financial literacy. And I think there's so much uncertainty when we're thinking about young people, because kind of as Hannah alluded to, we're moving around. There's so much change happening in such a short amount of time relative to maybe our previous years. We're going to college for the first time. We're becoming independent. And for that can also look like, being completely independent from parents, financially as well. So I know quite a few young adults who are having to enroll in Medicaid on their own without their parent support. And so I think that, when we think about financial advocacy and literacy, it cuts across socioeconomic statuses. And often, we don't often hear the stories of people who are having to enroll in Medicaid on their own for the first time, where they go to get that information. A lot of this information is not consolidated as well. So it's really challenging when we're thinking about all the different components of what financial literacy means and how to navigate those. And there's no really wand of like financial advocacy, as one of the social workers I know at UCSF, Benioff Children's, put it. It's, something that we all learn slowly, and we kind of have to navigate as we're approached with challenges, unfortunately. And it's also really hard because there's so much uncertainty for those of us who are transitioning through various parts of our lives because of, what's going to happen with the ACA, what's going to happen with certain policies that are going to truly affect us, and, our affordability for medications, getting on insurance, getting kicked off insurance, so many factors to talk about here.
Yeah, and so I've definitely heard this term financial literacy come up a lot of times, which I think, financial advocacy and financial literacy are sort of inextricably linked there. But so again, I've been hearing that, Medicaid, co-pays, co-pay assistance programs, all these things. I guess like when you think of just literacy, like how to learn to read, okay, I'll pick up more books. I'll start, with the smaller word books and the picture books and move up from there. But financial literacy, is there, I know you said there's not a magic wand, but like, where do you start? Are there a few resources where you can pick up some of those terms? I'll throw it back to you, Sneha, since you left us there.
Yeah, so there are quite a few places, maybe too many places, honestly, where you can find information about, how to take the first steps when navigating your own insurance. One place that I have found that's particularly useful is looking at your local children's hospital. And the reason for that is because a lot of times these national resources might not have state-specific information, which is very important. So for example, California, I'm in Indiana, but going to California, somewhere that's a little bit more popular, there's a lot of various ways to get information from, for example, UCSF Benioff Children's Hospital, or, from the state government website. So it's just really taking those initial steps. However, I will say, I think the best way to learn about information pertaining to financial advocacy is through talking to people. I think, being able to talk to a young adult patient peer who has gone through the process, who has navigated the process, is far more powerful than any standardized information that you might be able to get, because that's a great supplement. But hearing about personal experiences, about how to call, where to call is so powerful. And I think something that has been particularly impactful for me, but also for the many young adult patients that I work with as well.
Great, I couldn't agree more. All right, Sumaira, do you have any thoughts on where to send people on financial literacy, sharpening their skills?
Yeah, I mean, when I think back at when all of this first happened to me, I was only 25, so not very familiar with, all of the terminology, the very complex terminology that's associated with insurance, for example. And so I actually started by going to my insurance company's website. I had Blue Cross Blue Shield at the time. And interestingly enough, they had a very layperson's term glossary available. And, that's where I learned about what a deductible meant, what the difference between a copay in the emergency room versus an office visit is, and all of the above, really. The other thing I would like to say, too, is really heavily rely on your community, especially people who suffer from the same illness, because you learn so much from other people's experiences, and there are things that they can contribute to your journey in navigating all of this that you otherwise wouldn't have known to think about. So I think, discussing it with people who can relate in terms of diagnosis or even geographically, as Sneha said, is really important, because we're all in this together, and we all have different nuggets of knowledge than somebody else.
Absolutely. All right, Hannah, anything to add there?
Yeah, I think you both have hit it spot on. So I'll just add one extra piece of advice. Is I've actually been self-insured for the last few years as someone who's an entrepreneur, and I don't have an employer-sponsored health plan. And so navigating a marketplace is very confusing. I had no idea what type of plan, what company to pick, all of this. And so I actually found out that all of these marketplaces have different insurance brokers on there. And you're able to call those people and actually ask them questions. And so I would call 10 of them and ask, and I've switched marketplaces as I've moved across the country. And each time I've called multiple people and just ask these questions, what is the best plan? How do you recommend? Because I think asking questions is very important. You can do a lot of research online, but the human contact of being able to say, I have this condition, I need support in these areas. What would you recommend? And I think that goes a long way, because these people are typically sit and they represent all of the different insurance plans. And so this is a free resource. You're able to call them. It's in any state. And so I recommend doing that if you're going the route of being on a self-insured plan. But yes, I think all of what you guys said, I'll echo, and just to avoid being repetitive, but.
No, that's a great thing to add.
Yeah, I would also add that, if you are employed, to go to your, if there's like an employee assistance program or an HR department, they always have an abundance of information. They're trained and equipped to communicate all of this insurance information to employees. So if they're there, talk to them, ask them questions. There's no such thing as a stupid question, especially when it comes to insurance, because even physicians sometimes are so confused about how insurance works. Insurance, especially in this country, is a very complex topic. So ask all of the questions, ask as many questions to as many different entities as possible, because we're all learning this.
Well, Sumaira, I'm glad you said ask as many questions as possible, because I'm going to throw a pop quiz at all of you since we're talking so much about health insurance. Can someone tell me what is a deductible, what is a copay, what's an out-of-pocket max, and what's an appeal?
Oh dear. Should I start?
Please go, take it away.
Well, unfortunately, I've had experience with all of them, but the one I will answer to is an appeal. So I've had to do this a number of different times in my health journey. So insurance would deny approval of a treatment. And thankfully, I had champions in my corner advocating. They were my doctors, and they would write letters of appeals to the appeals department of an insurance. And, after 2-3 more denials, I would eventually get the drug. Now the drug approval. I understand that that's not how it works for everybody. But what I will say is that, no offense to the insurance companies, but their default answer is to always deny. And like Hannah said earlier, never give up. You have to just keep trying. You have to just keep fighting, and you have to keep advocating for yourself. And I think that time and again, at least in my personal experience, that has proved to work. Appeals work, and don't give up.
Awesome. All right. So what's a copay? What's a deductible? Premium, out-of-pocket max?
I'm happy to jump in with deductible.
Do it.
So a deductible is basically the amount that you pay before your insurance starts to pay. They'll range anywhere from $0 to $10,000 to $12,000 I've been seeing lately, which is insane. But that's the amount of money that you'll pay for services before your insurance kicks in. And then we'll start with copays and or co-insurance. A copay is basically how much you pay after you've met your deductible. In some cases, you still have that same copay. So if you were to go to your primary care doctor, your copay might be $30, and that's, you've hit your deductible, your insurance you're fully covered, and that's the amount that you pay for that visit. Anyone else have any other ones to add? I forget what the last one was, but
out-of-pocket max.
Out-of-pocket max. So that's the maximum amount that you'd pay per year. I'm actually dealing with that right now because I just had a crazy ambulance bill. And so that I've already hit my out-of-pocket max for the year. So that means that the insurance company would come and kick in. That's the maximum amount that you would have to spend out of your pocket.
Fantastic. Thank you. I think it's super important, I think, to know the lingo, as we're throwing all these terms around. You can't be a financial advocate if you don't speak the financial language. So I think with that, I know we have a question sort of to go off the one before. Are there any tools or resources that you would give to parents of teens and high schoolers to really help start that conversation around financial advocacy and literacy?
So I can go ahead and take this. And also, I just wanted to echo from the last question, too. It took me probably a solid couple of months to fully understand what those terms meant, because I had read the word deductible, copay so many times. But when I was actually having to deal with these languages by myself, when I was talking to the insurance company, it was like I'd seen that word for the first time. So I think it's also interesting because this is something that, you're going to gain with experience learning about. So you shouldn't feel like you're alone if you don't understand these words immediately or they make sense to you on paper, and then all of a sudden you're calling your insurance and you have no idea what you're talking about. So that's one thing. And so to answer your question, I would say that I think social workers are very, very great resources for parents to be in communication with, and also for young adults, the patients themselves to be in communication with as well. I think social workers have a wealth of knowledge about resources that are specific to the area, and a variety of options, such as, whether you might be eligible for SNAP, which is a nutrition assistance program, whether you might be eligible for low-income housing. So there's a lot of different components of financial advocacy and learning about it holistically that are particularly helpful. And I feel like social workers are a huge catalyst for bringing up conversations about topics that we as patients or caregivers might have not even thought of before. Couldn't
agree. Sumaira, anything to add?
No, I think these panelists are so good. I have nothing else to add to that.
I love it. All right, Hannah, anything before we move on to the next question?
I would just add that I think having the conversations early is better. I felt like my parents had, and not to say I have amazing parents, but they just didn't educate me on this and weren't explaining that, I just thought that insurance was something that everyone had. I was very ignorant in that way. And so I think just being able to have those conversations and showing from a younger age that, this is insurance and this is how it works. Just showing a bill that comes in the mail. I've got, my insurance card is sitting right here, but explaining what that does, being able to just show and educate in that way. And I think that should start really in middle school, high school, because as soon as you're out of college, depending on the state you live in, yet they say 26 is the cutoff for your parents' insurance, but that's not always the case. In my case, it's not. I'm 24 and I'm not on their insurance. And so I think it's really important to just continue to teach them from a young age.
And I would just propose that it would be great if we had a nationwide sort of educational implementation like these girls are suggesting, where whether it's your senior year of high school, in addition to learning about insurance, you learn about other practical things in adulthood. How do you write a check? You know, what is credit, and all these sorts of things that also go into your financial advocacy. If you don't have good credit, that might affect your bills, or it might affect, getting a credit card that would help you pay for copays. So, if there was some kind of a program in which young people were educated about these things in a more formal setting, I think we would be much better off in adulthood when, in an unfortunate situation, you do get diagnosed with something horrible and rare where you need to rely on your insurance.
Absolutely. I think that's a nationwide miss. I think we get too little just general financial literacy education, which brings me to my next question is, was there a miss in your own dealing with your own rare disease and coming to your own? I think of, again, like you were mentioning, Hannah, I let my parents handle my health insurance way too long, like well past how old you are. And then all of a sudden, when the bills started coming to me, I had no idea what to do. Is there anything that stands out to you guys of like, man, I wish I did that differently? Sneha, do we want to start with you?
Yeah, sure. So I, full disclosure, I just started doing my own insurance about a year and a half ago, and I'm 22 now. So probably should have started a little bit earlier, but my parents, I have the privilege of having wonderful, wonderful parents. So they sort of helped with that. So I think, the first suggestion I would have is that, and we were talking about this in the earlier panel that just happened, I think self-empowerment is so, so important. And so taking things into your own hands, starting at an earlier age, even when you have parents that are willing to do things for you, is going to really, really benefit you. I remember the first time I was calling insurance, I think last year or the year before, I, had just biked to class. I put my bike away and I was calling the insurance. I took out my insurance card and I saw like 4 numbers and I was like, oh my goodness, which number do I call? And so I called the insurance company and I was thinking that I would be able to get my drug approved in like 30 minutes, but it took like about 8 hours. And so I was like, I'm going to have to call you back. I have class. And so that whole week I spent talking to insurance and navigating the different language and terms and everything, and really fighting insurance to tell them that I need this drug right now. And there were lots of times where I gave up and I told my mom, I was like, I do not need this drug right now. But she was like, yes, you do. So I think, it also it's huge because it also feeds into non-compliance. So we talk a lot about, how in adolescence, young adulthood, there's a lot of non-compliance for taking medications and, doing your own thing. But it's also because our systems are set up in such a way to make for that, it's so difficult for us to be navigating these systems by ourselves. And I had a similar experience, which I might go into later on. I don't know if we have enough time, but I did an internship in Boston. And so I was researching at the Harvard Chan School of Public Health for about 10 hours every single day. And in the middle of that, I was fighting with my insurance company to get my infusion approved in Boston versus where I am in Indiana. And so there's just so many little components that we don't think about that it's so helpful to be prepared and start learning these concepts earlier on. So when you're in the situation, you're not spending hours and hours and hours with your insurance company.
Absolutely. I'm glad you got to continue to pursue your internship and still handle the stuff on the side with your insurance company. Hannah, any misses for you that you wish you did differently?
I honestly pretty much have the same kind of story there, but I think for me was just learning how to get all of that approved, especially with an IV. When I moved from Boston to Washington, D.C., I switched to a completely different plan, to a completely different state, and had to navigate finding, an at-home nurse, getting that approved through a certain insurance plan. Ended up having to switch from my employer plan to the marketplace. And so I think in those experiences, I just didn't realize how many steps were involved in getting my medication approved and to be able to, get my treatment that was saving my life. And so I think just, I mentioned this earlier, but just starting to learn while you're in the hands of your parents is really important, because it's, it's just something that it's hard to figure out on your own. And I was calling everyone in the book of, how do I do this? And I think it really you've got to learn from an earlier age, because don't wait until you're my age, because it was a tough lesson to learn all at once. So.
Absolutely. All right, Sumaira, any missives?
Yeah, 3 things. First of all, I'm clearly the old lady here. I'm 31. Second, I love that there's a Boston connection, because I live in Boston, and nice to see people loving Boston here. But no, the thing that I wish I had done earlier on is taken advantage of flexible savings accounts or health savings accounts. I didn't really know about that until after I got sick, and I have been, on my own with insurance since I was 21. But I would highly recommend that any young adults suffering from chronic illness who are relying heavily on treatments and medications take advantage of your employer's HSA or FSA offerings, because they are pre-tax, so it does save you money in the end. Every company does it differently, but you get the funds at the beginning of the year, and that for me has helped tremendously in terms of paying for co-pays, whether it's at the hospital or at the pharmacy. I wish I knew that earlier on, but now I do. And I think it's been a great addition to my financial advocacy.
Oh, that's awesome. I'm so glad you mentioned that, because I definitely max mine out every year. I'm an old lady too in that regard. So I guess we have a question in here about lifetime limits for insurance. We're talking so much about insurance, but I know for young adults, it's so much about financial advocacy. And, I personally, lifetime limits gets me at my core. And I really feel like health insurance isn't designed for young adults. I think it's, the way it's set up is it's assumed that everyone gets sick in their mid-60s and onwards, and then they can get on Medicare and it's all good. We don't have to worry about, young people who are working who might lose their job, who lose their employer-sponsored health insurance plan. And, how, I guess for health insurance, is there any advice, any things you would say to better design health insurance for young adults? I'll start with Sumaira, do you have something to say?
Yeah, I think understanding the differences between HMO versus PPO is really important. If I didn't have a chronic illness, I would be totally fine with getting an HMO. And it would be less expensive for me too. But, very early on in my illness, I was introduced to this idea of paying a little bit more to get a PPO, which made my life so much easier, because I didn't need referrals for the 10 different specialists that I was going to. The co-pays were different. The deductible was different. So in terms of choosing your insurance plan, I think taking the time to really review each of the different offerings and seeing what works best for you is very important.
Awesome. Anything else to add? How to better, I guess, design health insurance in mind with young adults who have chronic illness, rare disease? Hannah?
I would say to make it more educational throughout the process. It's a very, especially if you're going through a marketplace, there's just a lot of terms and I have no idea what to select. So maybe making it more of, suggestions and quizzes almost of, you're able to add in your condition and all of this stuff and the medications that you take, and they do give suggested plans, but I would like this to be more educational. I think health insurance is pretty antiquated. So if there's any health insurance creators out there, I hope that you just make it more, make it for young people. If that was a thing that they had educational videos in it, I would be watching them. I wouldn't have to call up my mom and say, hey, I don't know what the deductible means on this. So I think it's really important to just make it to the times. That would be my advice.
I agree. All right, Sneha, anything else to add?
Yeah. I think there's probably a lot of things if we get down to the details that we would change about insurance. But I'll talk a little bit about the role of social workers. I think that in a lot of places like Boston Children's and some of the more enterprising hospital systems, they have transition clinics and transition coordinators. And I know one of my someone that I absolutely adore, Colleen. She's a social worker at Boston Children's. She actually sits through the first calls and is on the first call to sort of walk, a young adult through their first time calling insurance. They do role play, they do, various things so that a young adult patient feels comfortable taking that first step to call their insurance company on their own. So I feel like, on behalf of insurance companies, I don't know if there's a way to incorporate more social workers as education specialists. I will say social workers are not accessible everywhere in the U.S. So where I'm at in Indiana, having a social worker for my specialty, at least when I was in the children's hospital, was sort of unheard of. But it's more of a mainstream thing in some bigger cities like Texas Children's, Boston Children's, UCSF, Benioff Children's. So I think social workers can play a huge role in education and really empowerment for young adults to start taking things in their own hands, as is being done in some select locations.
I love your emphasis of social workers. I think it so often gets forgotten when you're assembling your healthcare team. Don't forget about your mental health piece. I mean, for me, I was like, I said in the opening panel, I was like running a support group, and someone was like, my social worker said this, and it was like a light bulb of like, oh, I can have a social worker too. So that's just great advice all around. I do want to touch on disclosure a little bit, because I think anytime you're going to be, a health advocate, and particularly in advocating for your financial health, it involves talking about what your needs are, and sometimes saying it in ways that you don't necessarily feel comfortable with, or you feel pressured to say. I thought, Hannah, I'd start with you, especially because you center so much around employment. How do you advise people you're working with to handle disclosure of their disease?
It's a great question, and I always like to tell people that it's up to you to disclose, but that it doesn't hurt your chances of getting a job. I'm speaking with hundreds of employers every month, and I know for a fact that disclosing that you have a disability on a job application does not affect your ability to get that job, at least not with the hundreds of employers that I've spoken with. I think that it's up to you, and it's a personal choice, but I think it's best to do it up front. It's something that's really hard and really awkward to do. I didn't do it at my first job, and that really hurt me in the long run. I'm now very open about that with my employers, because I think that to have the resources and support and accommodations that you need to ask for that up front. And chances are, if you have a good employer, they're going to make those accommodations for you. But in terms of disclosing, I think, again, it's purely personal. You don't need to feel pressured to do that. But I think that it can benefit you in the long run if you're upfront and asking this employer, these are the things that I need, clear cut. Maybe it's that you need remote work, or maybe it's that you need a service animal, whatever it may be. But it just helps facilitate a smoother conversation if you say this at the beginning, and that way you're able to get those resources from the get-go. That's what I would say about disclosure at work.
Awesome. All right. Anything to add, Sumaira?
Yeah, I mean, just to echo what Hannah said, the other thing is that your diagnosis does not define you. It only defines you if you let it define you. And, just speaking from my personal experience, my work has always spoken for itself. And I've always worn my diagnosis with pride. I'm very open about it. And I think because of my output, my employers have always been so impressed with the fact that I am able to do such a good job despite all the things that I deal with. The other thing I would say with employers is that one of the benefits of disclosing it, especially earlier on, is that you can learn about accommodations, like Hannah said, and resources earlier on that you would have otherwise not known about. So, for example, when my employer found out that I was half blind, they said, oh my God, you can actually get a discounted train pass. I had no idea that was the case. And so my train pass is a fraction of what my coworkers pay. They told me that my egg harvestation would actually be covered because of the situation that I was going through. I would have never known that. And if I had called my insurance and done it that way, maybe I wouldn't have gotten the approval as quickly as I did, knowing that my employer has had experience with this. So Like Hannah said, it's obviously up to you if you want to disclose it or not. But in my experience, disclosing it very early on has opened doors and opportunities and resources for me. And, I'll just go back to saying that your diagnosis does not define you.
Awesome. Wow. I'm so glad you've gotten a discounted drink pass. That's great. And good to discover resources you never known about. You can go places.
It helps.
Those tea passes are expensive.
Those tea passes are expensive.
So Sneha, I'm thinking about you and, you're doing your internship and doing the research and juggling, all these calls at the same time. How did you handle disclosure in that scenario or elsewhere?
Yeah, so when I was researching at the Chan School of Public Health, they didn't have like a set disability office, which made it very, very difficult for me to be open about my chronic condition when I was amongst these researchers that expected me to be there and be present all the time. So, I won't talk too much about my experience at Chan, but last year I was researching at the Chan School of Public Health for half the summer, and then I was interning at a major pharmaceutical company in New York City, their corporate headquarters. So when I say corporate, I mean, it was like picture perfect corporate. It was a very, very structured environment. And I think one thing for me was realizing how hard it is to actually disclose something. So with Health Advocacy Summit, we do so many workshops around storytelling. I mean, a lot of our work is surrounding storytelling and sort of using that to transition into adulthood, whether that be with your social life or with various scenarios, whether that be education, employment, etc. But when I was at this pharmaceutical company, it was so intimidating to disclose my chronic illness, even though I have talked a lot about storytelling, talked a lot about my own chronic illness, but when you're actually faced with, talking about your chronic illness in an environment that doesn't feel welcoming, it's very, very challenging. And so I think, it takes a lot of courage to disclose something in, when you're somewhere that you feel like everyone is working like 24/7, they have no, chronic conditions or, nothing that's impeding them from maybe working 8-hour days. And so I actually did not disclose while I was interning at that pharmaceutical company because I was only there for 6 weeks and I was, scared about the repercussions of talking about my chronic illness. So, I think that's one thing to keep in mind. And also with internships, it's also very different, but it is absolutely your right. And you should not feel afraid to disclose about your chronic illness, even if you're there for just several weeks or a couple of months as well.
Absolutely. I couldn't agree more. And I mean, it's disheartening to hear when you're working in a health industry and you're not feeling comfortable there. That's the place where you should feel most capable to disclose. But again, it is your right. And there are lots of protections and things that, that protect you from having to disclose. I did, thinking of Sumaira's comments, I wanted to ask Hannah, what are the resources in an employment situation that a new hire should be looking for in terms of getting accommodations and things?
Yeah. So, there's tons of resources on this. I think the best place to start would be by checking out the Job Accommodation Network. It's a place it's an organization that falls under the Department of Labor. They've got a number of resources in terms of accommodations, employment resources. I also encourage you guys to check out companies like ours, Chronically Capable. We are specifically focused on finding jobs for people with a chronic condition. And so it's places like these that you can actually find the support from both the organization, others in the community. I think also, talking with others in the community is a really important thing to do. I know Health Advocacy Summit is a great resource for young people who are in this space because there's other people that you can meet and get to attend events. I know they do a lot of virtual workshops and chats, and those are the places where you can ask others, about their experience. Asking for accommodations is something that you are allowed to do, and employers, they will make them. It's because they're required to make them if they are if they are a registered employer. And so just asking for those up front, I think is important, and seeking out resources like the Job Accommodation, like Chronically Capable. There's a lot of places, and I think asking your peers is key as well.
Perfect. All right, we're coming up against time, but I wanted to ask one final question. If each of your organizations was written a blank check where you could fund one financial advocacy program for rare young adults, how would you spend it? Sumaira, I'll start with you.
Oh gosh, you give me the hard ones all the time. How would I spend it specifically for young adults? Oh God.
I could go ahead if you need a little bit.
Go ahead, Sneha. Give her more time.
Just because I think one thing for myself, so we work with a lot of marginalized groups with Health Advocacy Summit, so all the way from South Texas, so 10 minutes away from the border of Texas and Mexico to, attendees from rural places in Indiana. And so I would strongly want to focus more initiatives on providing resources and empowering marginalized young adult patients who otherwise are not given the resources and tools to be able to adequately transition into adulthood. I think there's a huge disparity, especially when we're talking about South Texas, in not only access to quality care, but access to health literacy resources that their parents or guardians might not have right off the bat. I think I would love for us to be able to provide more resources and directly impact the populations that we have been impacting, but do so at a larger scale and directly providing them resources and tools.
Awesome. All right. Hannah, how about you?
This is going to make Sneha feel embarrassed, but I think I would put my check into, organizations like hers, because these are the places where these conversations are happening. And I think we need to invest in young people because this, we are the future. And so I think those are the places that the money needs to be going to.
Love it.
Sorry to put you on the spot.
All right, Sumaira, we're coming back to you.
All right, this is going to seem like a cheap shot, but I do mean it. I would actually put my money into both of your organizations. The awareness and the education is super important that Sneha is working on. And I know so many young chronically ill patients who have trouble finding jobs and internships. And the fact that, an organization like Hannah's exists where they help place them is very important. You guys are both right in the sense that we are the future and we should be equipped and, filled with resources to do good for the world. And if we can't, then that sucks.
Wow. Oh my gosh. I know we talk about collaboration so much at Global Genes in these conferences, but everyone out there, young adults, the next generation, we are a very collaborative bunch. So, support us. All right. Thank you so much to Hannah, Sumaira, and Sneha for this incredible conversation. I'm feeling like $1 million after this great discussion. And thank you to the audience for your great questions and for tuning in. And please join us later for Angel Eve Presents Stress RX, Stress Resilience and Sensory Self-Care in a Micro Moment Day. Thank you so much, everybody.
Thank you so much.
Thank you.